Hi, everyone. I hope this message finds you well mentally and physically. I'm seeing you all and I'm looking forward to the time when the world starts to turn again. I am excited to present to you today on health policy implications of genetics and genomes. This is especially dear to my heart because, as you all know, I have a brother who passed away from a genetic disorder, alpha-1 antitrypsin deficiency. You're going to be tired of me talking about that by the end of this program. And after he was diagnosed, then our family had genetic testing done, and I am the only other person out of 4 children who also has the same genetic condition. Part of the tragedy of my brother's passing was that he was misdiagnosed for many, many years, even though he had symptoms of alpha 1. And so, again, I feel passionate about, genetic testing and the implications of how that can change somebody's life for the good or for the bad. So the population that this impacts is an estimated 1 in 70 people born in the United States have a genetic disorder. I actually think it's much higher than that because there are many, many people who may have a genetic disorder that just isn't diagnosed, people like my brother. There are over 6,000 identified genetic disorders, which are often debilitating or deadly. And who is at risk? Everyone's at risk. I'm going to give you a couple seconds to grab a piece of paper and to write down what you think the top 5 genetic conditions in the United States are. Okay. All right, so everyone have their answers? So before I tell you what the answers are, I want to explain to you why it was tricky for me to find this. There are different categories of genetic disorders. Some of them are multi-gene, some of them are multifactorial, mitochondrial. And so I had to kind of look at a bunch of different lists to find out what the type 5 were using my statistics from Dr. Contreras' class to figure out the prevalence of the disorders. So with no further wait, the top 5 genetic conditions in the United States are thalassemia, sickle cell anemia, which that one actually surprised me, cystic fibrosis, Down syndrome, and then familial hypercholesterolemia. And those are not in order of top to bottom. Those are just the top 5 genetic conditions based off of my compiling a lot of different research. So costs in our healthcare. People with a genetic disorder are more likely to have surgical procedures, extended hospital stays, and higher mortality rates. And what does that mean? It means a lot of money. And again, finding a specific number for a genetic disorder was impossible because, someone with cystic fibrosis is going to probably have a lot of healthcare costs. Someone with alpha-1 antitrypsin deficiency like me will probably have very little or typical healthcare costs. The average can be anywhere from 2.1 billion to 8.1 billion a year on the healthcare system. Again, not for just one patient, but for genetic disorders. The barriers to advanced practice nursing. I think the biggest barrier, and this is also supported in the research, is a lack of education or awareness of the genetic condition. Like I said, there are 6,000 identified genetic disorders, and there's no way that any one medical program, nursing program, will be able to cover all of that. And so we can't manage it or treat it or identify it if we're not educated on the genetic condition. So ensuring privacy and confidentiality of genetic and genomic information is a barrier. Patient concern for genetic discrimination. This is a real thing, and I read about it a lot when I'm doing research for my project, and also I am part of some forums for Alpha One, and people talk about this all the time on the forum. Something kind of interesting with the coronavirus is that having Alpha One, it can impact your lungs and puts you at a higher risk for a poor outcome with coronavirus. And so a lot of people with Alpha One are in the high risk category, and they are trying to decide if they should disclose that to their employer or not, and be able to stay home during this pandemic for those jobs that are essential. genetic screening for family members or family planning genetic screening, also outside resources for genetic screening, 23andMe, and the cost and the time of managing these patients and the misuse of genetic testing are also barriers. Policy change impacting this population. Section 2713 under the ACA coverage of preventive health services, it now covers genetic screening for some genetic risk factors like breast cancer. Also under the Affordable Care Act, genetic counseling is now covered, which I love. Moving on, key issues for policy change. Genetic disorders impact everyone. We all probably know someone who has a genetic disorder, and I know you guys do because you know me. Genetic disorders are expensive to manage. Genetic testing is readily available with or without a provider involvement, and that's a little bit scary to me. To go back to the 23andMe and, Ancestry, things like that, I think it's a little bit scary that people can go out and have that done without any provider involvement, because who follows up on these if there is a problem? And also, as a provider, I don't really want to be brought in the results with no warning and be asked to interpret them when I'm not familiar with it. Education needs to be a priority for healthcare providers on interpreting genetic testing results and managing disorders. Again, that interpretation part I think is key. That's something that's not, again, usually being taught in our educational programs, but now providers are being asked to interpret that. So what can providers do? Contribute a nursing perspective to genetic policy discussion, use care delivery strategies that incorporate genetics, and conduct educational seminars to address genetic learning needs of health professionals and clients. And that's, part of my passion, part of what I do with Alpha One Foundation, and part of my project is to bring awareness and education to this one genetic disorder that has impacted me and my family. And there are so many other, and so much room for further teaching. Here are my references. Thank you so much for your time, and I look forward to seeing you guys again. Thanks. Bye.